and on the recommendation of the National Coronavirus Command Council, Cabinet has decided that the country should move to adjusted alert level 4. Cabinet decided that to ensure that our response is appropriate and proportionate, in other words, equal to the current situation, additional restrictions are necessary. And we are therefore announcing this evening that we will place these additional restrictions in place for the next 14 days. And after 14 days, we will examine exactly where we are. We will assess the impact of these interventions and restrictions after these 14 days to determine whether they need to be maintained or adjusted. Therefore, the following measures are to be in place across the country from tomorrow, Monday, the 28th of June 2021, to Sunday, the 11th of July 2021. All gatherings, whether indoors or outdoors, are prohibited. These include political, cultural, social, and religious gatherings. Funerals and cremations will continue to be permitted, but attendance may not exceed 50 people, and all social distancing and health protocols must be observed. Night vigils, after funeral gatherings, and so-called after tears gatherings are not allowed. Public spaces such as beaches and parks will remain open. However, no gatherings will be permitted at such places. A curfew will be in place from 9 p.m. to 4 a.m. and all non-essential establishments will need to close by 8 p.m. The sale of alcohol, both for on-site and off-site consumption, is prohibited. Our Ministerial Advisory Committee has advised that the limited restrictions that we previously imposed were not that effective, and that a prohibition will ease the pressure that is placed on hospital services by alcohol-related emergency incidents. Because of the burden of infections in Gauteng, travel in and out of the province for leisure purposes will be prohibited. This does not include work, business or commercial travel, transit through airports, or for the transport of goods. If you are currently not in your place of residence, you will be allowed to return home to or from Gauteng. Visits to old age homes, care facilities, and other congregant settings will be restricted. Restaurants and other eateries will only be permitted to sell food for takeaway or delivery. This is because it is not possible for patrons at restaurants to wear masks while eating or drinking in these establishments. The closure of schools and other educational institutions for the winter holidays will be brought forward. Schools will start closing from this coming Wednesday, the 30th of June, and all schools will be expected to be closed by the end of the week on Friday. Contact classes at tertiary institutions will end by Wednesday, the 30th of June, with limited access to the institutions. Residencies, however, will remain open at those institutions. The Ministers of Basic Education and Higher Education, Science and Innovation will provide further details on these arrangements. The measures that we are putting in place now are designed to allow as much economic activity to continue as possible while containing the spread of the virus. Most businesses will continue to operate at full capacity and should not be affected, as long as they observe all the health protocols in their workplaces. Our focus is on limiting social contacts while preserving the economy and preserving livelihoods. I want to emphasize that it remains mandatory, compulsory in other words, for every person to wear a face mask that always covers their nose and mouth when in public spaces. It is a criminal offense not to do so. The owners and managers of public buildings, centers, shops, restaurants, taxis and buses all have a responsibility to ensure that people on their premises or in their vehicles or facilities wear masks. All employers must allow their staff to work from home whenever possible and should postpone all non-essential travel and workplace gatherings. Government will also be putting in place measures to reduce physical attendance of government civil servants at workplaces while limiting the disruption of government activities and services. As we implement these restrictions, we are continuing to work to strengthen the capacity of our health system. In Gauteng, the loss of significant capacity due to the ongoing closure of the Charlotte Maxeke Hospital is adding strain to our other hospitals. We are doing everything we can to provide additional bed capacity and speed up the reopening of Charlotte Maxeke. At present, Gauteng has made available 830 additional beds by postponing elective surgery and another 400 beds constructed with alternative building technology that are now being activated. We have been engaging with the producers of medical oxygen to increase their production to accommodate the anticipated increase in cases. We are constantly monitoring the PPE stocks and medicine stock availability so that we can intervene where we see declines in stock levels. The Gauteng Department of Health is recruiting additional human resources, that is health workers, to support increased workload. The Solidarity Fund has provided financial support to the recruitment and placement of additional nurses in Gauteng hospitals to complement the military health teams that have been deployed. To ensure that there is sufficient hospital bed space, we have to reprioritize service provision to ensure there is capacity to treat those with severe cases of COVID-19. We are forging ahead with our rapidly expanding national vaccine program. The program has picked up pace significantly, with key milestones being achieved as we move forward. As of midnight yesterday, nearly 2.7 million South Africa had received a vaccine dose. In the last week, the daily vaccine rate had surpassed 100,000. I still want to see this reaching 300,000. I've told the acting Minister of Health. In the last 3 days, we have received an additional 1.2 million doses of the Johnson & Johnson vaccine and 1.4 million doses of the Pfizer vaccine through the COVAX facility. With these additional supplies, we will be able to rapidly increase the rate of vaccination this week and in weeks that follow. In line with our national rollout plan, over 950,000 healthcare workers have now been vaccinated across the country, and the registration and vaccination of this cohort continues. The second phase of our rollout has also gone well, with the drive for the registration and vaccination of the over 60-year group continuing to yield good results. Although we'd still like to see people who are over 60 to come forward in their numbers. Whilst we have yet to reach all the estimated 5 million citizens in this group, each province has now embarked on social mobilization drives to assist our elderly to register and to receive their vaccinations. And I've been pleased to notice that our vaccination program is now also welcoming those who just walk in, due to the difficulties that they have of registering and all that. We have said they must allow people to walk in and get vaccinated, those who are over 60 and those in other age groups, as I will talk about now. To date, 3.8 million people have been registered on the electronic vaccination database. The National Vaccination Program will continue along 3 defined streams. The first stream is the general population according to age groups. The next cohort, that is group of 50 to 59-year-old